Well, thank you for joining us today because I've been looking forward to this conversation with you, Zara.
Thank you for having me, Tabitha.
Yeah. Um, when you told me that you were an occupational therapist, and your dad has LGI1 autoimmune encephalitis, and you were sharing about occupational therapy and the value of rehabilitation and the different therapies um, for folks with autoimmune encephalitis, um, we invited you on because this is this is an area that is not familiar to
hmm
people who are just entering. For the first time, many of them have a medical situation that they've never had to even think about what rehabilitation is or what
hmm
it looks like or what the value is. So
And I
I
wouldn't have thought about it either if it wasn't a personal thing to me. Like I wouldn't have researched how OT can help autoimmune encephalitis if it wasn't a personal thing to me. So at least some good is coming out of it.
what tell me that part of your journey when your dad was diagnosed and how you started looking at what you do professionally, you know?
So my dad was diagnosed about 3 years ago. His first symptoms were a little bit weird. He was 59 when he started having these symptoms. So he started with like panic attacks and weird kind of twitching that we weren't sure about. And then it progressed quickly to dementia. He would forget, that his mother passed away and things like that. So we had no idea what to do. We took him to the hospital. He was in and out of hospitals and rehabs, and they couldn't find a diagnosis. They were ready to say he has early onset Alzheimer's. I mean, crazy stuff. So even when we didn't have a diagnosis, I was kind of just trying to do some research to figure out what I can provide for my dad, exercise wise, or even when he was, in the hospital, just trying to advocate for him because I am trained, on the medical side of things. So it was nice for me to be in the hospital, being able to talk to all the doctors, you know, and just advocate for my dad because I feel like sometimes they don't like to listen to you unless you're a professional too.
Yeah, finding the path forward for a positive communication with the medical team uh, is another video.
Another thing.
But good for you. So once he received a diagnosis, and it took a while, right?
It took about 6 months,
Right.
in and out of hospitals and rehabs. I mean, he wasn't in a full coma, but he was not really responsive at some points, not alert.
Wow.
So, yeah, it was scary. They were just throwing out diagnoses at first. And then we
Yeah,
finally got him into John Hopkins in Maryland,
right.
and they diagnosed him within 2 weeks. So,
Yeah. And
Dr.
that's the
Probasco,
encephalitis.
the
Plug for John Hopkins.
plug
John
for
Hopkins.
Dr. Probasco coming on and talking to
Abs
us.
yes, absolutely. Thank goodness for that. So here you are, you know what the diagnosis is now, and you're seeing occupational therapy plays a role here.
Mhm.
Tell us about that. Walk us through that.
So I'm a home care occupational therapist. I work mostly with older adults, but people with disabilities on mostly Medicare, and I go to their homes and treat them. So my first thought, especially when he got out of the hospital and he was home, was no matter what diagnosis he had, was immediate. We need to get him therapy, just because he had balance issues, strength issues. So wherever they were coming from, it still would. I felt it would still be beneficial. Um, so I really focused on looking at like just how OT can treat general brain injury, general neuro diagnoses, because there's not a lot of info on OT and autoimmune encephalitis out there yet. But the symptoms are similar to brain injuries. So it is a
Well,
brain injury. So I kind of more so took that path of like just looking into things I could do to help my dad, places he can go, once he got to a certain point where my mom could take him out to outpatient therapy, he worked with like an encephalitis therapist. So it was, just me doing all my research and helping out in any way I could. But it's still not a researched enough topic. So there's not
Right,
much research out there specifically on therapy and autoimmune encephalitis. But
right.
yeah,
So you were talking to me about acute care, and the kind of care as you're working through, like, uh, what can an OT do when someone is in coma or the acute stage of consciousness, and kind of moving through that. Can you review that for those who are watching at home?
yeah. So when someone's in a coma or comatose state, it's really on the caregivers and the medical team to be able to advocate for them and to really do the right thing by them. So I feel like from my experience in talking to other people who have AE, sometimes the medical team won't suggest PT or OT during this time because they don't feel like there's much to get out of. But it's just so important to keep the person mobilized because when they do come out of the coma, it helps their neurons connect with their muscles to be able to, you know,
That's your
restart.
friendly
That's
dog.
my friendly dog. To
That's
restart the
okay.
process of getting, getting better and getting, being able to stand up and all that. So um, I just think it's important to do any range of motion exercises. So like, moving their joints, moving their arms, moving their legs, in all of the directions that they can go, just so they're staying mobilized. And, you know, because when you're laying down in a hospital bed, even for a week, and then you come out of the hospital, you're so much weaker. So even without
So
being,
So this is something that may not be prescribed at this point, or certainly not as commonly as you would like to see it as an
Mhm.
occupational therapist. And so you're encouraging people to ask questions about it. Now, um, how about the nursing staff when somebody is in um, a coma in the hospital? Can you ask, is this something that a family member can learn to do, or should they ask a caseworker at the hospital or a social worker at the hospital to be assigned to their case to assist with having someone from rehab coming in at this point? How would a family member begin to advocate for that?
Yeah, I mean, I would definitely all the medical staff that's on the team, the nurses, the neurologists, whoever's treating the patient. I definitely think it's important for the caregivers to advocate for their patients and say, if a lot of the times if you say I want my wife, my daughter, my father to have physical or occupational therapy, the hospital will typically set up an evaluation because it's by request. Now if they're going to continue with therapy, I don't, that's up to the individual therapist. But this is also something that, I mean, if you just type it on YouTube, range of motion exercises for coma state or range of motion exercises for all joints, I mean, you can find ways to keep them mobilized, keep their muscles going, and their joints just moving. And this is something you could do daily for your, whoever
When
your
when
family
when
member is.
you're when you're visiting your loved one in the hospital, to follow those types of protocols as you're working with the team too. So it's a very loving thing to do. It's
Yeah.
as a caregiver for your loved one.
Mhm.
Um, I I haven't heard until you mentioned it to me that occupational therapy or physical therapy, because in a sense it could be both people,
Oh,
couldn't
yeah.
it? Coming from both professions,
Yeah.
that starting it in a comatose state, usually patients are reporting to us that it's later in their initial long-term stay when they're diagnosed and
Mhm. And
and
that
go
may
through
also
those
be
initial
due to
treatments.
insurance issues or like I've never really worked in a hospital as an OT, so I don't know the like background of if insurance covers it or if it doesn't. So there might be other reasons why they're not doing it,
I'm
you know.
glad you brought I'm glad you brought that up because the team wants the best for the patient no matter what. And unfortunately in the United States, because of the way medical insurance works, that can hinder in certain situations.
Mhm.
So as anyone who's watching is at that point, working with the team and coming up with a plan that everybody can participate in is
Mhm.
what you're advising they advocate for. And
Yeah.
I really love that. Um, and so once that person is conscious, that acute stage,
Mhm.
what can you advise us in that area?
So it's definitely really important once they're conscious, alert, enough to tolerate. Early mobilization is so important. So whether it's just moving your leg up and down, I mean, it can start, you know, slow and move up, but if the person is able to stand and do all these things, it's so important to move right away. As long as it's safe, of course.
And right, everything has to be safe. Everything has to be cleared by the doctor, gait belts, whatever tools that are needed to support the individual
Yeah.
in that regard. Um, oh, I had a question and now I've already forgotten what it was. So,
Also,
so
mobilization is also really good for it can decrease infection. So like pneumonia or like when you're in the hospital, um, laying down all the time, if you sit up or keep moving, it can decrease the risk for catching certain illnesses or having blood clots in your legs or things like that. So it's also
boy,
really
that's
good on
really
the
that's
medical
vital.
standpoint.
That's
Yeah,
that's the same reason that they say when anyone ever has a surgery to get up and get moving for
yeah,
that reason as well.
yeah.
And I can see why it would be particularly important here too.
Mhm.
So is our neuroplasticity impacted as early as you're talking about right now with new neurons making connections when it comes to somebody who's had a brain injury?
Yeah, I mean, maybe not in every single case, but
Mhm.
yeah, you're once you're in an alert stage and potentially even a comatose state. I mean, we don't really know exactly, how your neurons are reacting, your neuroplasticity is reacting in a comatose state, but um, once you're up and mobilizing, your body, you have like this muscle memory, and your
Right.
body will kind of remember how to walk, how to do these things, how to move your leg, how to move your arm. So it's so important to do it early on. And even if they're not recommending therapy early on, I mean, as long as it's safe, just sitting at the edge of the bed, even from compared to laying down at the bed is a big deal. Um,
Yeah. And
yeah.
and you're making an important point here too. When I got sick in 2013, and back then it wasn't as recognized as it is now. So I wasn't diagnosed until almost 14 months after my onset. When I was doing rehabilitation and I needed to learn to walk again because I had gone from cane to walker to scooter and back again. The rehabilitation specialist I had said to me, your brain has known how to walk for 55 years.
Mhm.
It's there. You just need how to relearn
Mhm.
to do that. And so it can happen very quickly. Now, I was still dealing with all those balance issues for a long time, you
Yeah.
know, but the initial learning to walk again, um, I thought I didn't realize there were so many things to remember when
Yeah.
I'm walking, you
Yeah. You
know.
don't think like, okay, heel toe, okay. You
Yes.
think of those things when you're walking.
Yes. And I would come out of rehabilitation. I'd say to my husband, "Look at that woman." There's like a professional woman with a briefcase, and I said, "See how she's swinging her arms? See how she's holding her shoulders? See her
You know,
strut?
you start to notice it.
She
Like,
knows how to walk." All those things you have to remember. Oh
yeah,
gosh. And it comes back and we can do it. And it's remembering, no, it's you don't
yeah,
walk like Frankenstein. It is heel toe. Yeah.
yeah.
So then are there any other things in that stage that you wanted to bring up?
So, in terms of like, yeah, so in my research, I was looking into, just encephalitis, autoimmune encephalitis with hospital stays, and they've seen that rehab can lead to decreased hospital stay, potentially improve the length of time of recovery. Um, so things like that. And if a person is at this point of being able to walk and do these things, PT and OT will also help with like balance training, getting that back as well.
Right. And so then is the next stage inpatient rehabilitation for some people
Typically, yeah. I mean, some people I'm sure can go right home, not
directly home?
necessarily without caregiving, but yeah, typically after, especially after a long hospital stay, I mean, your even without a neurological condition, your muscles just diminish. So a lot of times they'll send you to a rehab. Typically, it's you get 5 to 6 days of rehab a day. You get medical care. You get 24/7 staff to help if you need help dressing, you need help, go to the bathroom, things like that. So, especially if someone doesn't have a caregiver at home and, you know, can't do all these things, they're not just going to send you home. So,
Right. And I just want to reiterate to our viewers that asking that a case manager be assigned to your case, that could be through your insurance,
yeah.
because their job is to be an advocate for you and to make sure that you receive the care that your doctor wants you to receive.
Mhm.
In some cases, as we're talking, that could be, we'll send someone who can give you a bath twice a week. Um,
Yeah.
to more advanced assistance to, well, maybe you need a bedside commode, or maybe you
Mhm.
need is something uh, to keep you safe in the bed, or whatever it is. They will
And
send,
that's something that the rehab team will order for
right,
the
and
person. So even a wheelchair, a walker, and they would order that potentially like during the rehab stay, but also just for when you get home. So they would order
right,
it to
because
your house.
they will also send someone to your home to assess your home.
Yes. Sometimes you do have to ask for that though. Sometimes you do need to get like a script from the doctor or things like that. So that's just an important point because a lot of people don't know that you can get rehab in your home.
Exactly, which is why this conversation is so important, because it
Yeah.
informs people on what to ask for. Um, we're not always aware of all of the help that is
Yeah.
available to us. So so at this point, here you are, you're in inpatient rehabilitation, and during that part, what else do you want us to know?
So the focus in inpatient rehab is solely to get you home, like safe enough to get you home. So sometimes you get home, they'll send you home or if insurance stops covering it. So sometimes they'll send you home and you're not going to just be, okay, we're good, back to
Right.
normal, especially with this condition. So, a lot of times they'll either initiate to get home care to get therapy in the home, but a lot of times you're sent home and you need a lot of caregiver assistance still and you're not maybe able to go up the stairs to your bedroom yet. They might recommend a hospital bed if it's hard for you to get in and out of bed. So it's not like this inpatient rehab is just going to be the cure and you're going home and you know all
It's
is
the
good. It's a
beginning of a
journey.
long, it's the beginning of a long journey.
Yeah.
Yeah, and we like to say it's a marathon and not a sprint,
Yeah.
and not to look for improvement by days and weeks, but months and years, because
Mhm.
that's our situation. But the brain is miraculous
Yeah.
in how we recover. And when you see how incredibly impaired we are at the beginning, and then you see us years later, people do people have trouble even believing that we went through what we went through.
Yeah. Yeah.
It's astonishing. And hope is a very real word. We don't blow smoke and sunshine around here with this kind of journey. Um, it's very true how much we recover. Now, many of us are left with lasting brain injury. I am.
Mhm.
But that hasn't stopped me from having a full life and doing everything I want
Yeah.
to do. It may take me a heck of a lot longer, but we get there. So now here we are. We're at that point. The person's getting home.
Mhm.
Okay. How about home care rehabilitation?
So typically it would either be initiated by the inpatient rehab. So the doctor there would write a script because you need a script to see a therapist at home, at least in New Jersey. Um, and so typically if they recommend it at home, they would initiate that, or you may have to go to your primary care physician, say I need therapy, and they would typically give you like a list of local home care agencies, or, if you have a preference of one, then you can use that. So I worked for a home care agency, so they would get the script from the doctor and verify insurance and, things like that. And then I would get the case and I would go out and evaluate their home. So I would be looking for any fall risks to see if any equipment needs to be ordered in their bathroom, how they're walking around, how their safety is. A lot of times they're not aware of they don't have the safety awareness as well to
Right,
say, oh, I need to use my walker. Specifically for my dad, because of how young he was at 59, he's like, I don't need a walker, but yes, dad, you do, So things like that. And it can be hard. Like my dad won't listen to me. He'll listen to his therapist though. Um,
right, right.
so
You're his
it can
daughter.
be hard. Yeah, what do I know?
Yeah, that's right.
Yeah, so it's things like that. And then once we evaluate, we see where their strengths are, where they, need help with, we'll make our goals, and then we can get them started on a home exercise program. So typically home care is like 2 to 3 times a week. We go to the home for about an hour and work with them. Yeah.
So here I am. My loved one needs rehabilitation. I can be anywhere. We both happen to be on uh, East Coast, West Coast of the United States. Um, Rehabilitation for an autoimmune encephalitis patient hasn't become a specialty yet because we're
Mhm.
too early on. It was only, autoimmune encephalitis was first discovered in 2007,
Mhm.
and the years that have transpired has been on research to understand the disease and that it's actually a group of diseases.
Mhm.
And a few years ago, looking at the importance of comprehensive care, um, which brings this into the mix and how important rehabilitation is. But I'm not aware of a rehabilitation program outside of, say, Mayo Clinic Rochester,
Mhm.
that specifically understands autoimmune encephalitis patients. So here we are. Who knows where you are in the world? Um, what direction does someone go out? How do we advocate for our folks about somebody who needs care after encephalitis? Even, and I'm putting that globally out, not just for AE, for encephalitis, period, because we're in the same boat when it comes to
Mhm.
rehabilitation. Um, do
Oh,
do
sorry.
we ask for a brain injury specialist? What's your recommendation?
So with home care, they typically don't have like a specialist. I mean, there might be someone who knows more about it, but in home care, you get who you get. It's whoever's in, or at least with, certain companies, whoever's in your region is who's taking your case. So with home care, but if you really wanted to go out for like a specialist, there are, I mean, for me, I'm in New Jersey. JFK Hospital has a great outpatient encephalitis specialization clinic, which my dad actually has been on and off going there. So I think that's just like a research thing based on where you are, to
So,
find
so
clinics.
asking your neurologist,
Yeah.
do they know somebody locally that can be accessed, that they've sent other autoimmune encephalitis or
Mhm.
encephalitis patients to? Because there are some people who have only had experience, say, with a
Mhm.
stroke patient, and we're different,
And it's different. Yeah.
you know? And um, so that is a good avenue because together as a community, as the greater community in autoimmune encephalitis, we are paving a brand new road. We're paving a way for better outcomes and rehabilitation one by
Mhm.
one.
Yeah.
And so for those who are watching us, that's what you're together, all of us collectively
Yeah.
are doing is to ask the questions about rehabilitation, about the kind of experience, who's had a patient like this, and if the answer is nobody's ever had a patient like this, then will you please get on the phone, occupational therapist, physical therapist, speech therapist, and find somebody who has
Yeah.
and consult with them on my loved one's case to get some direction.
Yeah. And
Oh,
I mean, it's normal for someone not to have experience in all avenues. Like if I get a patient maybe
right,
with a certain disease and I know my colleague has more experience with that disease and they're able to go out
right.
there, like we may recommend each other. So I mean, it's not always going to be that a physical or occupational therapist or speech therapist has that experience with um, encephalitis, but there are definitely, at least in America, there's definitely clinics that will specialize in encephalitis or brain injury of
Right,
some sort.
right,
Yeah.
right. So here we are, we're home, and we're working on helping that person get through the day,
Yeah.
you know, um, functional tasks. And let's be honest, it kind of begins with where am I and what am I supposed to do?
Yeah. Yeah. What am I supposed to do?
Yeah, it's like, what am I supposed to do now? Well, getting dressed would be nice, you know?
Yeah. Yeah. And then I think that the caregiver at this point, still, the caregiver may still have to help the person depending on where they're at. But the goal of OT and PT and speech is just to get them to be more independent or as independent as they possibly can at that point. So, um, yeah, my dad went from, I mean, I was in the hospital helping him go to the bathroom. I mean, he's might be getting a
Yes,
little embarrassed right
sure.
sometimes. I mean, like to that point where, and he was 59, like he's,
Yeah.
you know, I could see how that's embarrassing as well. But now I mean, he gets himself dressed, goes to the bathroom himself. My mom might have to help him with his remembering to take his medication or like things like that, maybe cooking, but he still came a long way. So, and we're still
And
going.
medication is a good example because it can be very complicated for us with all of the different pills that we take every day. There are a lot of different supports out there for medication management
Mhm.
that people can look into. We have several options on the International Autoimmune Encephalitis Society website for apps and tools that
Mhm.
people can use. Um, but occupational therapy, You're dealing with a wide range of relearning of skills. Can you talk
Mhm.
about some of what we're talking about
Yeah.
here?
So it could be as basic as bathing, dressing, toileting, and it can go up to grocery shopping or cooking, a multi-step dinner or things like that. So it's kind of, we would evaluate and base it off of where the person's at. And also, I think something important about occupational therapy is we focus on what the patient wants to work on. I mean, of course, we
Yes.
need to have these basic tasks, but if someone says, "Oh, I used to always blow dry my hair and I can't reach my hand up to blow dry my hair." I mean, that's not something you have to do, but that's something that the person really loved and that's something they want to get back to. So,
And to me, you're now touching on an extremely important aspect of this because let's be honest, this is a lot of work.
mhm.
Having gone through rehabilitation, I could tell you this is a lot of
Yeah,
work. Um, I had to care. It had to matter to me. It
yeah,
had to be something that I loved. And you've zeroed exactly in on people in the family want to help their loved one so much, and they will come up with different ideas like, well, maybe I'll have him work on a crossword puzzle or
mhm.
Sudoku.
Yeah,
But this person doesn't like a crossword puzzle and they've never
yeah,
done Sudoku.
yeah. My dad
Um,
never liked his word searches.
so you're not going to pick that.
Mhm,
Um, because when we're talking about executive functions and brain injury, you're talking about everything we do. From the time we wake up in the morning until the time we go to bed, we're using our brain.
mhm. Yeah,
And it's harder because we have an injury. And so our brain has to work harder to do simple things, which builds into the neurofatigue that we experience. And we do better in the morning than we do in the afternoon because
mhm.
we've
Yeah,
used our brain and go back to the spoon theory.
yeah,
Um, we're out of spoons, and so we start misspeaking more and having trouble finding words more. And
yeah,
um, for me, I had two personal goals, and they saw me in very good stead. I wanted to walk my dog. That was
yeah.
really important to
Aw.
me. You know, we have
You
beautiful
can't say the
parks.
W word around my
She's, oh, I used the W
dog.
word.
She's
I'm
out the
sorry,
window.
sweet baby. Yeah, that was kind of cruel. Sorry. Um, yes.
That's
And
okay.
um, and I was a gourmet cook and I loved cooking. And I had to start with a box chocolate cookie recipe, which I'd never made in my life because, gulp. Um, and I wasn't able to follow those simple directions that are in
Mhm.
words and pictures. I struggled.
Yeah.
So I started there and I had a friend who acted as my aide, and we started something called Rehab Cooking Wednesday.
I love that.
And every Wednesday we spent all day cooking. And after 2 years of Rehab Cooking Wednesday, I
Cool.
could make pretty much whatever I wanted to make without
Mhm.
putting the same ingredient in two or three times. That would
Yeah.
be
Oh,
edible,
that's a big deal. Yeah.
because you forgot that you just,
Yeah.
excuse me.
And you taste it and you're like,
I was known for my pumpkin pie at Thanksgiving and I had to throw the pie away.
oh,
So that was painful.
yeah.
But the next year it was a favorite. Yeah, it's hard, but picking something that you love, no matter what it is, it could be a hobby, or an interest. You are using all of your executive functions to do that, and it's not work. You're
Yeah.
motivated to do.
Yeah. And I
So,
wanted to touch on when you said that some people, they're at a certain time of the day, or they might be, um, you know, they might be more tired or difficult finding words. So I just wanted to specify that, like, typically, at least me, but most therapists will like try to find a time slot for our patients that like work for them. So it's like if they're a morning person, I'll try to get you at 9 a.m. or you know. But I have some patients that like can't even wake up till 1 p.m. and I'm seeing them in the afternoon. So
Right.
it's
See
also
them at
like,
their best
yeah,
time of the day
yeah,
where they really are fresh and
yeah.
not already work through a
Hmm.
lot of their spoons for the day. Right. So, is there anything else that you want to kind of share in that aspect of it? It's a long period we're talking
Yeah,
about.
yeah,
Rehabilitation from autoimmune encephalitis. Think months and years, not days and weeks,
yeah,
folks. Um, but we do make progress.
yeah. And
So,
there's
so,
also so many fluctuations with it. Like my dad was discharged from therapy and he was pretty good. He really didn't need his walker. He doesn't use his walker anyway. That's a different story. But he didn't need the walker, in my opinion. And then even just recently, my mom was like, he's just off, like his walking's off again, but not to the point where like anything was wrong.
right.
But it's just, he's starting to chip up a little. So we got him therapy again. So,
Yeah.
it doesn't have to be like a one-time thing and then done. It could be a one-time thing. And then a few months later, if, you're noticing your loved one is, having a more difficult time, even with cognitive things like, and they need speech therapy again. Um, you know, it's, it's just a long-term thing. It doesn't have to be a
And
quick.
yes, and family observations are so helpful.
Mhm.
You know, you all notice things we're not aware of.
Yeah.
You see the shift or the
Especially like,
change.
for example, my dad, he will from the outside, like if one of his friends visits or whatever, they not that they think he's perfect, but they don't notice, especially
Uh,
because he might be putting on a show or like a,
oh, it's interesting how we fake people out. Yes.
yeah. And so we'll be like, how did they not know? Like me and my mom will be like, you know, he did this or that, but they don't notice it because they're seeing him maybe for an hour or like, even sometimes in the neurologist's office, he'll fake them out a little bit.
Yeah, because we want to get better.
Yeah.
So, it's I kind of view it as resilience, a patience aspect of resilience. Um, I may think now, I didn't process the last paragraph of what you said. This is,
That's okay.
me inside internally. But I'm going to smile and carry on, and you're going to think that I understood exactly what you said and got the end of that
Hmm.
story, or I didn't. But you don't need to know that.
To show that you are
And
part of the
and and it
conversation.
and that yes, because we're coping and we're in a social situation and there's a lot of moving parts to a social situation. And then I might, turn to someone else who was with me to say, what did they say and what did they mean? And did I miss something?
Yeah.
Yeah, sure. It's something that we do. But we also, my husband would notice improvement before I would notice it in certain
Okay. Yeah.
in certain things. Um, I used to reach for a glass and miss where the glass was,
Hmm.
so I would knock the glass over. That was pretty regular. So that's a visual thing that is
Yeah.
happening. Um, but then I also had trouble holding the glass.
Hmm.
And you would think I would notice when I wasn't knocking the glass over as much. But to me, I was having so many cognitive issues about what I was managing that when something improved, I didn't notice it. My husband would point it out to me.
Hmm.
And it's wonderful to have
Hmm.
someone in your family be able to say, have you noticed that you haven't knocked that a glass over? Do you notice
Hmm.
that you're
Yeah.
doing that? And it's like, oh my God, he's right. You
Yeah.
know, it's interesting how how progress creeps up on us. We all of a sudden we have an aha moment that
Yeah.
we've reached a new baseline. you know, which is really interesting. So when it comes to like recovery and years later, what else would you like to kind of share? Because that's where your dad is. How many years out
Yeah,
is he?
about 3. So we've kind of hit
Yeah.
the point where we're seeing like a little plateau, like we'll go up and down, fluctuate a little bit. Um, yeah, so he's at the point of all he wants to do is drive. So that's all he wants to do. So he's kind of at the point where he's done neuropsychology tests to determine if he's eligible for a driving program. Typically, a driving program is usually run by an OT that has a driving certification and certain courses that you have to take to be specialized in that. And then they would start in a simulation, or just with the processing of okay, I'm going to put my right directional on, but I also have to look here, and that type of thing.
Multitasking.
Yeah,
Ex,
multitasking.
ex, mhm.
So he's kind of at that stage right now. He is still like being tested, and we're kind of at that point. We're not sure if he's gonna drive, but we're at that point of like really working towards that.
And
So
and people are in different, situations that will be listening to us. Some people have seizures, and so then they're not allowed
yeah,
to drive for a certain period of time. Um, and so some people have had their license, taken away, where others haven't. And
mhm,
it's a matter of knowing that no matter what, you have proven safely that you are able to get
yeah,
behind uh, the wheel of a, steering wheel of a car
yeah,
again.
yeah.
And it's a huge liberation.
Oh yeah,
And and it was 5 years for me. Um, w- there was someone I just met in our monthly Zoom meetings, AE Tuesday Tries, who just reached that milestone recently. She was at five
that's
years,
great.
and a few other people in that group who have reached that milestone.
Mhm.
It's incredibly liberating.
Oh yeah,
It's one I assumed I would never be able to drive again. I just had got to a place where I'm going to be okay with this. Um, and part of that was not wanting to be disappointed. So it's
yeah,
like if I accept where I am, then
hmm
I'm just going to accept that I'm comfortable here. That doesn't mean that I didn't stop trying.
yeah,
It was an emotional adjustment where so when I did meet it, it was, oh my gosh, I really didn't. Who in the world would have expected that I would have
yeah.
been able to reach that again?
Coming from,
And
you said you had to relearn to walk, and then
absolutely, absolutely everything.
yeah,
And that's how we are. You think you're going to be living in this space, and this is your baseline, and this is where you are. And with autoimmune encephalitis, it just nudges and nudges, and it's slow,
hmm it's
but
slow.
we
Yeah,
continue to get there. And then you look back and say, oh my gosh, I cannot believe where I am today.
yeah,
Who would have ever imagined this? And I think that is the most hopeful thing with this group of diseases that we can really leave the audience with today is hope is real.
yeah,
Progress is
yes,
absolutely real.
yeah. Keep staying motivated. Keep working at it. It's a journey.
Well, I've really enjoyed this conversation. And I hope that people who are listening will, make a comment about what they thought, or if they have any questions, that we could get some feedback too. If there's something else
Yeah,
uh that, would you be willing to come on and do another
of course.
show?
Yeah,
Oh, and I know you're incredibly busy.
Mhm.
So let's put that out to the
Yeah.
audience because I'm throwing this on to Zara as we're talking.
No, you're
But
not. I
but
definitely
if
will.
you but if you have a comment and you want to ask a question, then do comment. We'll keep up and watch for what your interests are. And if it's enough to start another conversation and talk about those
Yeah.
things, then let's get back together same
Mhm.
time,
Yeah.
same channel um and do it again.
Yep.
Um, this recording is going to be released during February 2025, which is Autoimmune Encephalitis Awareness Month. So we ask that you subscribe, hit the notification bell so you know when a new video goes up.
Mhm.
And Zara, thank you for your time. Thank you for
Well,
your
thank you so much for
valuable.
having me.
Oh, it's been such a wonderful conversation. We really appreciate it. And we'll be talking to you
Be
soon.
talking.
Thanks. Bye-bye.
Bye.